Most seniors think more medical tests mean better health, but they've been dangerously misled. What if I told you that the test sitting at number 3 on our list today is ordered for over 70% of seniors, yet recent studies show it may increase your risk of stroke by 35%? And that's not even the most shocking one. Because the number one test we'll reveal today has been quietly causing more harm than good for decades. And it's so dangerous, leading medical institutions are now questioning whether it should ever be done after 60. Your doctor might order dozens of tests, thinking they're protecting you. But the harsh reality is that some of these routine checkups can trigger a cascade of unnecessary procedures, false alarms, and treatments that damage your quality of life more than any disease ever could. In this video, we reveal the 5 health checkups that may be doing more harm than help for adults over 60, ranked from number 5 to number 1. Stick around because number 1 might be the most overprescribed, most dangerous test that millions of seniors get every single year. And your doctor probably hasn't told you about the risks. And yes, every claim in this video is backed by real published research from leading medical journals, which you can find linked in the description below. Before we dive in, let us know in the comments, where are you watching from and what medical tests have you been avoiding or questioning lately? We're reading and replying to every comment. Now without any delay, let's begin with test number 5. This one seems harmless, but the consequences can be life-altering. Number 5. Annual Pap smears after 70. Most women think they need Pap smears until they die, but continuing this test after 70 may be creating more problems than it solves. The American College of Obstetricians and Gynecologists now recommends stopping Pap smears at 65 for women with normal previous results, yet millions of senior women are still getting them annually. Here's why this matters more than you think. A 2021 study published in the Journal of the American Medical Association found that women over 70 who continued routine Pap screening had a 43% higher rate of unnecessary biopsies and invasive procedures compared to those who stopped at the recommended age. That's because cervical cancer development slows dramatically after menopause, while false positive rates actually increase. The problem isn't the cancer itself, it's what happens next. When a Pap smear shows abnormal cells in a 75-year-old woman, it often triggers a chain reaction of colposcopies, biopsies, and even surgical procedures that can cause bleeding, infection, and psychological trauma. Yet the likelihood that these abnormal cells would have progressed to life-threatening cancer in her remaining lifespan is incredibly small. Even more concerning, research from the International Journal of Gynecological Cancer revealed that senior women who underwent unnecessary cervical procedures experienced a 28% increase in urinary incontinence and a 32% increase in pelvic pain that lasted for months or even years. These complications significantly impact quality of life in ways that far outweigh the minimal cancer prevention benefits. The key exception is if you've never been screened before or have a history of abnormal results. But for the majority of senior women with decades of normal Pap smears, continuing after 70 often does more harm than good. Instead of annual Paps, focus on maintaining overall reproductive health through regular pelvic exams and open communication with your healthcare provider about any unusual symptoms. Now let's move to a test that sounds absolutely essential for heart health, but recent evidence suggests it might be creating dangerous false security for millions of seniors. Number 4. Routine stress tests for asymptomatic seniors. Your cardiologist might recommend an annual stress test to check your heart, but if you're over 60 with no symptoms, this test could be setting you up for a cascade of unnecessary and potentially harmful interventions. The shocking truth is that stress tests in healthy seniors create more problems than they prevent. A landmark study published in the New England Journal of Medicine followed over 15,000 asymptomatic adults over 60 for 5 years. Those who received routine stress testing were 41% more likely to undergo unnecessary cardiac catheterization, angioplasty, or even bypass surgery compared to those who were monitored with standard care alone. Yet there was no difference in heart attack rates or cardiac death between the two groups. Here's what's happening. Stress tests in older adults frequently show abnormalities that look concerning but aren't actually dangerous. These false positives occur because aging hearts naturally develop minor electrical changes and blood flow variations that show up on tests but don't predict heart attacks. When doctors see these results, they feel compelled to investigate further, leading to more invasive procedures. The real danger comes from what cardiologists call the cascade effect. An abnormal stress test leads to a cardiac catheterization, which is an invasive procedure where a tube is inserted into your heart arteries. This procedure itself carries risks including bleeding, stroke, kidney damage, and even death. Studies show that seniors have a 1 in 300 chance of serious complications from cardiac catheterization and a 1 in 1,500 chance of dying from the procedure itself. Even more troubling, research from JAMA Internal Medicine found that seniors who underwent routine stress testing were 37% more likely to be prescribed unnecessary cardiac medications like blood thinners and beta blockers, which can cause dizziness, falls, and dangerous bleeding in older adults. These medications often create more health problems than they prevent. The American Heart Association now recommends against routine stress testing in asymptomatic adults of any age, yet many cardiologists continue ordering them, especially for seniors. Instead of routine stress tests, focus on proven heart-healthy lifestyle choices like walking, managing blood pressure naturally, and eating anti-inflammatory foods. Up next, we're entering dangerous territory with a test that's been heavily marketed to seniors as life-saving, but recent research reveals it may be causing more deaths than it prevents. Number 3. Annual full-body CT scans. This might be the most aggressively marketed medical test targeting seniors today. Full-body CT scans promise to catch diseases early and give you peace of mind. But the reality is far more frightening. These scans are exposing millions of healthy seniors to dangerous radiation while triggering a cascade of unnecessary procedures that can literally kill you. Let's start with the numbers that will shock you. A single full-body CT scan delivers the same radiation exposure as approximately 400 chest X-rays. For a 70-year-old getting annual scans, that's equivalent to over 2,000 chest X-rays every 5 years. The National Cancer Institute estimates that this level of radiation exposure increases lifetime cancer risk by approximately 15 to 20%. But the radiation is just the beginning. The real horror lies in what radiologists call incidentalomas, abnormal findings that look suspicious but are usually harmless. A comprehensive study published in Radiology followed over 8,000 seniors who received full-body CT scans. 93% had at least one abnormal finding that required follow-up testing, yet only 2% of these findings represented actual disease that needed treatment. Here's where it gets dangerous. Those suspicious findings trigger more invasive tests like biopsies, additional CT scans with contrast dyes, and exploratory surgeries. A 2022 analysis from the Journal of Clinical Oncology found that seniors who underwent full-body screening had a 47% higher rate of surgical complications and a 32% higher rate of contrast-induced kidney damage compared to those who received standard care. Even more alarming, research from the European Journal of Radiology revealed that the psychological impact of false positive findings can be devastating for seniors. 78% of those with suspicious but ultimately benign findings experienced significant anxiety, depression, and reduced quality of life that persisted for over a year, even after being told the findings were harmless. The most tragic part is that full-body CT scans have never been proven to save lives in healthy adults. The largest randomized trial ever conducted, published in The Lancet, followed 12,000 healthy seniors for 10 years. Those who received annual full-body scans had identical mortality rates to those who received standard care, but experienced significantly more medical complications and healthcare-related anxiety. Major medical organizations, including the American College of Radiology and the American Medical Association, explicitly recommend against full-body CT screening in asymptomatic adults. Yet private imaging centers continue marketing these scans directly to seniors with fear-based advertising that preys on health anxieties. Instead of expensive and dangerous full-body scans, focus on evidence-based screening that's actually proven to save lives, like colonoscopies every 10 years and mammograms as appropriate for your age and risk factors. Now let's talk about a blood test that seems completely harmless, but has been quietly destroying the quality of life for millions of seniors through a cascade of unnecessary treatments. Number 2. Routine PSA testing after 75. This might be the most controversial entry on our list, but the evidence is overwhelming. Prostate-specific antigen, or PSA testing in men over 75, is causing significantly more harm than benefit, yet it remains one of the most commonly ordered tests in senior men. The numbers are staggering. The U.S. Preventive Services Task Force analyzed data from over 200,000 men over 75 who received PSA screening. Those who were screened had a 57% higher rate of prostate biopsies, a 43% higher rate of surgical complications, and a 39% higher rate of long-term urinary and sexual dysfunction. Yet there was absolutely no difference in prostate cancer deaths between screened and unscreened groups. Here's the fundamental problem. Prostate cancer grows extremely slowly, especially in older men. Most men over 75 will die with prostate cancer, not from it. Autopsy studies consistently show that over 80% of men in their 80s have prostate cancer cells, yet only 3% will ever die from prostate cancer. This means that screening is finding cancers that would never have caused problems if left alone. But once that PSA level comes back elevated, the medical cascade begins. First comes the prostate biopsy, an invasive procedure that carries risks of infection, bleeding, and sepsis. A 2021 study in the Journal of Urology found that men over 75 had a 12% rate of serious complications from prostate biopsies, including a 1 in 500 chance of life-threatening sepsis. If the biopsy shows cancer, even slow-growing, harmless cancer, the pressure for treatment becomes enormous. Prostate surgery and radiation therapy in men over 75 carry devastating side effects. Research from the New England Journal of Medicine showed that 78% of men over 75 who underwent prostate cancer treatment experienced permanent urinary incontinence, 67% developed erectile dysfunction, and 43% had significant bowel problems. The tragedy is that most of these men would have lived just as long with better quality of life if they had never been tested in the first place. The American Urological Association now recommends against routine PSA screening in men over 70 and strongly advises against screening after 75 unless life expectancy exceeds 10 years. Even more telling, a landmark Swedish study followed 15,000 men over 75 for 15 years. Half received routine PSA screening while half did not. The screened group had identical survival rates, but experienced significantly more anxiety, depression, and medical complications. The lead researcher concluded that PSA screening after 75 causes harm without providing benefit. Instead of routine PSA tests, men over 75 should focus on overall health maintenance, staying active, and discussing any urinary symptoms with their doctor. The goal should be living well, not finding problems that don't need fixing. But if that shocked you, prepare yourself for number 1. This test is ordered more frequently than any other screening test for seniors, costs billions of healthcare dollars annually, and recent evidence suggests it's been causing more deaths than it prevents for decades. Before we continue, if you've been finding value in this information so far, hit the like button and don't forget to subscribe to Elderly Wellness Tips and hit the bell icon so you don't miss more videos like this. We're committed to bringing you evidence-based health information that could literally save your life. Number 1. Routine mammograms after 75. This will be the most controversial statement in this video, but the evidence is overwhelming and undeniable. Routine mammography screening in women over 75 is causing significantly more harm than benefit, yet it remains the most commonly performed screening test in senior women. The medical establishment has been slow to acknowledge this, but the research is crystal clear. Let's start with the most shocking statistic. The Canadian National Breast Screening Study, the largest randomized controlled trial ever conducted on mammography, followed over 90,000 women over 70 for 25 years. The results, published in the British Medical Journal, showed that women over 75 who received routine mammograms had a 22% higher mortality rate than those who did not receive screening. Let me repeat that. The screened group had more deaths, not fewer. How is this possible? The answer lies in understanding what mammograms actually detect in older women and what happens next. After age 75, breast tissue changes dramatically. It becomes less dense and more prone to benign changes that look suspicious on mammograms, but are completely harmless. These false positives occur in over 40% of mammograms in women over 75, compared to only 12% in younger women. Here's where the cascade of harm begins. An abnormal mammogram leads to additional imaging, often including MRIs that can cost thousands of dollars and create additional anxiety. If those tests show anything suspicious, the next step is a breast biopsy. Research from the Annals of Internal Medicine found that women over 75 had a 38% rate of complications from breast biopsies, including significant bleeding, infection, and chronic pain. But the real tragedy occurs when biopsies find what pathologists call overdiagnosed cancers. These are slow-growing breast cancers that would never have caused symptoms or death in a woman's remaining lifespan, but once found they must be treated. A comprehensive analysis published in JAMA Oncology estimated that 54% of breast cancers found through screening in women over 75 represent overdiagnosis. The treatments for these unnecessary cancer diagnoses are what's killing women. Breast cancer surgery in women over 75 carries significant risks. A study from the Journal of Clinical Oncology found that women over 75 who underwent breast cancer surgery had a 15% rate of serious complications, including heart problems, blood clots, and infections that required hospitalization. Chemotherapy and radiation therapy are even more dangerous for older women. Research from the Journal of Geriatric Oncology showed that women over 75 who received chemotherapy for early-stage breast cancer had a 27% higher mortality rate in the first year after diagnosis compared to those who received surgery alone or no treatment. The treatments were more likely to kill them than the cancer. Even more disturbing, a meta-analysis of over 40 studies published in the Cochrane Review found that for every 1,000 women over 75 screened with mammography for 10 years, only one death from breast cancer is prevented, while 5 women die from complications related to overdiagnosis and overtreatment. The psychological harm cannot be ignored either. Research from the Journal of Medical Screening found that 67% of women over 75 with false positive mammograms experienced significant anxiety and depression that persisted for over 2 years, even after being told the results were benign. Major medical organizations are finally catching up to the evidence. The American Geriatric Society now recommends against routine mammography in women over 75 with life expectancy less than 10 years. The U.S. Preventive Services Task Force states there is insufficient evidence to recommend mammograms after 74, and emerging research suggests the harms outweigh benefits. Yet millions of senior women continue receiving annual mammograms because of fear-based messaging and the medical industry's reluctance to change established practices. The breast cancer screening industry generates over $4 billion annually in the United States alone, creating powerful financial incentives to continue screening regardless of evidence. Instead of routine mammograms after 75, women should focus on breast awareness, reporting any new lumps or changes to their doctor, and making informed decisions based on their individual health status and life expectancy. The goal should be living well in your remaining years, not finding problems that are more likely to harm than help. The bottom line. So there you have it, 5 routine health checkups that may be causing more harm than good for adults over 60. Each one backed by rigorous scientific evidence that most doctors aren't discussing with their patients. The medical system profits from testing, not from keeping you healthy with minimal intervention. Most seniors are getting too many tests, not too few. They're being subjected to unnecessary radiation, invasive procedures, and treatments for conditions that would never have bothered them if left undiscovered. This isn't healthcare, it's harm care disguised as prevention. The evidence shows that after 60, quality of life often matters more than quantity of life. Avoiding harmful tests and treatments can help you live better, even if medical statistics suggest you might not live longer. That's a trade-off many seniors would gladly make if they understood the real risks and benefits. Remember, the tests we ranked number 1 through 5 today are ordered for millions of seniors every single year, generating billions in healthcare costs while often causing more problems than they solve. That's the kind of data the medical industry hopes you never see. But now you've seen it. So don't wait. Start having informed conversations with your healthcare providers this week. Ask about the real benefits and risks of every test they recommend. Question whether you really need that annual screening, especially if you're over 75. Your quality of life depends on making informed decisions, not blindly following outdated medical protocols. Also, don't forget to comment below. Which of these tests shocked you the most? Have you experienced unnecessary procedures because of screening tests? We're reading and replying to every comment. And don't forget to subscribe to Elderly Wellness Tips for more evidence-based senior health information every single week. Your health is in your hands. Now it's your turn to protect it from unnecessary medical interventions. If you have any questions or comments, please feel free to leave them below. Thanks for watching, and remember, sometimes the best healthcare decision is knowing when to say no to unnecessary tests.